When we have therapeutic drugs that act as antigens, the B cell response is again no different than a B cell response to a pathogen. The immunogenicity B cell response is the one that we're going to explain right now, which is the response from the B cell. It can react to the complete drug, to the whole antigen. So the B cells can identify the whole antigen. They can then digest it and present the T cell epitope directly to the T cell to activate it. And the B cells respond to these activated T cells. So when the T cells are presented, either from the B cell or from a dendritic cell, a particular epitope that comes from a drug, they can then produce cytokines that stimulate the B cells. These B cells will become activated and they secrete cytokines themselves, like interleukin 6 or TNF, and they can also develop or differentiate into plasma cells that eventually will produce the antibodies. But an important part of this whole T cell activation is the production in the B cell response of memory B cells. Now, not all of the immunogenic responses will have memory, but if they do, it is very important for us to understand if the patient is presenting with a primary response, which is the first activation of the B cells with anti-drug antibodies, but they could disappear. Or if it's a secondary response where these antibodies will always be there and will always be secreted whenever there's new exposure to the antigen. So the B cell response to the drug is what we know as the anti-drug antibody induction. Let's review what is the primary and the secondary B cell responses. This is taken from Abbas, Lichtman, and Pillai, Cellular and Molecular Immunology. Excellent professors and teachers. If you have an opportunity to either read their materials or attend their workshops and seminars, I encourage you to do it. So when we have a first infection or first encounter with the antigen, we have a naive T cell that will recognize the whole antigen. And basically what happens is that this will become activated. The activation will actually make them differentiate into plasma cells, and the typical results of this plasma cell over time will be short-lived plasma cells with production of mainly IgM antibodies to the antigen. So a few things that are important from this cartoon is how fast does this response occur? This is an adaptive response and it's delayed. It depends on purpose. There's no units on these graphs because it depends on the antigen and also depends on the amount of antigen that the body is seeing that you are going to be able to detect anti-drug antibody or antibodies to the antigen if it's not a drug on the scale. But you actually will see a significant increase from the baseline, from when the patient starts responding. So there is at least fourfold or fivefold increase in the titers when they get to have the maximum response. The other thing that's critical to understand is that they're mainly IgM antibodies. There may be a small amount of IgG antibodies in what we know as primary B cell response. What happens later is that there's the long-lived plasma cells in the bone marrow will actually make the titers go down, not to the level before the exposure with antigen, but to a much lower level, let's say about threefold lower than what the maximal response was. This whole first graph could be 30 days. It could be that the maximal response is within 15 days, and then by day 30, you see still the remaining of antibodies when there's long-lived plasma cells in the bone marrow. they also can cause memory B cells. So if we're talking about a vaccination, or if we're talking about a pathogen like hepatitis B, or if we're talking about any kind of drug that could cause a response, the times could be different. They could be longer or they could be shorter. But basically, what you know is that the highest titers are about 3 times higher than the ones that will remain in the blood if there's a lingering memory response. If not, then they would go back to baseline and basically would be a primary response and not become secondary response. The secondary response is seen when we now have these memory B cells in the system and there's a repeat exposure to the antigen. So this could be a second dose of a particular drug, or it could be a repeat infection, or when we have a vaccine that needs a second immunization, because we do know that the responses to some vaccinations require several injections to build up the appropriate adaptive B cell response to them. That's the case, for instance, of hepatitis B, but it could also be for tetanus toxoid. So for several different conditions, we do need to make sure that we have a secondary response, or in the cases that we don't want more exposure, we could identify if the patient has created a memory response when we give a second dose of a particular drug to the patient. If the patient has memory cells, these cells very quickly will differentiate into the plasma cells. So there's two important things in the secondary response reaction. Number one, titers. The titer booster is a significant increase to anywhere between 3 and 10-fold higher than what is seen on the primary response. The other thing is that it does take a shorter time to get this peak response, and that's by design. We have mounted an adaptive B cell response to deal with a potential danger, so we actually have a higher amount faster. And the other thing that's important is that this is IgG. You will not have IgM antibodies because they were mature cells. And then we do have the persistence of long-lived plasma cells, the bone marrow, and the memory B cells, which is a very critical aspect of the adaptive immune system. So the adaptive system has memory. And you can see that the baseline after a secondary response, now the baseline titers of the antibodies is at least twice higher, 2-fold higher than the memory response we had after the primary response. So when an individual develops a secondary response in terms of the B cell response and antibodies, the titers will be higher than they were before. These are all things that you need to consider when you are seeing your patients and you want to determine the level of antibodies that they have, and you want to understand if it's a primary response or if there's a memory secondary response to deal with it appropriately. To create these slides, I used many different references, but there's a few that I'm putting right here for you. But of course, you can see other YouTube channels for explanations, or you can look at the many, many different publications available. But I just wanted to acknowledge the ones that I've been using to create these talks. Thank you. I hope you enjoyed it. And if you did, please like and subscribe to my channel for future notifications when I post another video. Thank you very much.